Despite a global decline in adolescent birth rates, South Africa is witnessing a distressing surge in teenage pregnancies. As the country marks Pregnancy Awareness Week, the South African Society of Psychiatrists has emphasized the critical mental health impact on teenage mothers. On Christmas Day in 2023 alone, 145 of the 1,708 births were to teenage mothers. And on New Year's Day, recorded 190 teenage births. These included two 14-year-olds from KwaZulu-Natal and the Eastern Cape provinces. Between April 2021 and March 2022, a staggering 90,000 pregnancies were recorded for girls aged between 10 and 19, and over 150,000 young girls being pregnant in the 2022 and 2023 financial year. To unpack this a bit more further for us, we're now joined by Dr Naz Daniels, a member of the South African Society of Psychiatrists for more. And she joins us via our video link. Dr Naz, thank you so much for joining us this evening here on SABC News. And my first question to you, I mean, we see so much awareness being done around teenage pregnancies and teenage births. Why do we still see this increase in, teenagers falling pregnant?
Good evening, Mbali. Thanks for having me on your show. Look, I think it's probably multifactorial why we still see an increase in teenage pregnancies in South Africa. I think there are probably socioeconomic contributing factors. I think we clearly are not doing well enough in terms of sex education, in terms of provision and access to contraception, the problems we have with gender-based violence. So I think that there are a number of factors that contribute to this rise. And, while it is Pregnancy Awareness Week, as a Society of Psychiatrists, we really want to bring to the public's attention the real mental health burden of teenage pregnancy. We're aware of many issues that arise from teenage pregnancy, but we particularly want to highlight the impact on the mental health of both the mother and the babies that are born to these young women.
And when you look at mental health challenges, which are experienced by many people across the world, and this is now being experienced by a teenager, a young mom who's still trying to find herself in society, what does this do to the mental health of a teenager who's just given birth to a little baby?
Yeah, well, we know that in pregnancy, for women of all ages, about 1 in 3 women will suffer from mental health difficulties, either during their pregnancy or postpartum. And with teenagers, we see about a 30% increase in that figure. So the number is significant. And it's not just, it's during the pregnancy as well as in the postpartum period. A lot of teenage pregnancies are unplanned pregnancies. So there's a lot of stress and anxiety that goes with that. One sees stigma and rejection by peers and sometimes families and communities. And often women will then conceal their pregnancies and not access appropriate antenatal care, which is such an important time, both in terms of healthcare provision, but also in terms of being able to identify whether there is any mental illness arising. So we see an increase in the whole host of mental health problems that we deal with. So mood difficulties, anxiety disorders, PTSD, panic disorder, suicidal thinking, and we know that generally there has been an increase in teenage suicide. And again, desperate teenagers might be pushed to thoughts of self-harm or suicide. So, during the pregnancy, one sees all of that. And then postpartum, this is a young person who is now dealing with the transition to parenthood at a time when really they should be parented themselves still. So again, that puts one at high risk of really all manner of mental health problems.
And dealing with that aspect, your last note there, looking at postpartum, when it comes to teenagers, what does postpartum look like? If, you've described that many mothers across the world generally suffer from postpartum, and if you're having a young person who's just, given birth to this little blessing, at the same time, what does that look like for them? Because, their lives have completely changed.
Yeah, I think that's a real issue, the developmental impact. Teenagers are at a stage in their lives where developmentally what they should be going through is looking at completing their education, thinking about educational employment opportunities in the future. Whereas now, when you have the role of parenting thrust upon you, that disrupts all of that. And so I think another important reason to engage really communities in these conversations is that we need intergenerational support, because for these young women to be able to continue with their path, they're not going to be able to do it alone. And so I think both communities and families, but also health services, have a real responsibility. We need adolescent-friendly health services where women can go postpartum and not feel that they'll be judged and stigmatized, but rather met with care and empathy, so that we're able to identify and treat these mental health problems, and then again help them reintegrate into whatever their journey might have been had they not fallen pregnant.
And of course, a lot of teenagers who fall pregnant, they often shamed, their parents are disappointed. How does one seek for support when you already know that you're already being shamed because of the child you are carrying?
Yeah, it really is a problem, because I think that sort of shame leads to avoidance of help seeking. We know that pregnancies where there are mental health problems, it doesn't just impact the mental health of the mother, but you see higher rates of pregnancy complications. So things like preterm births and low birth weight babies, all of which make that pregnancy or that baby when it's born, more of a challenge than a baby that was full term where there weren't complications. And what we're very aware of is infant mental health. So the idea of attachment, that for an infant to develop in its own right psychologically, to develop optimally, it needs to have an attachment figure who is well and able to meet all of his or her needs. And when you have a mother who is actually a teenager and perhaps not equipped either in terms of maturity or in other ways to deal with having a baby, it really impacts not just her own health, but also potentially the health and development of that baby. So again, I think if we're looking towards the future, we have two people potentially impacted and at risk when there's a teenage pregnancy. And so it's really something that is important for us to be speaking about and raising awareness about.
And of course, as we mark Pregnancy Awareness Week, what would you say should be prioritized by society, to prevent problems around mental health, especially for teenage mothers?
Look, I think the issue with teen pregnancy starts before the pregnancy. I think there need to be open conversations about, sex education, contraception for young people. And these are difficult conversations that parents and families sometimes shy away from. But I think that is very, very important. And I think increasingly this idea of no health without mental health, I think that message is getting out there. So the idea that we need to prioritize the mental health of our pregnant young people as much as we prioritize their physical well-being and the support in that regard. So I think really just raising awareness, and for all of us, being on the lookout, I suppose, whether it's our peers or people in our families or communities that are going through perhaps an unplanned pregnancy or teenage pregnancy, really being alive to the idea that their mental health may be impacted and that they are vulnerable in that way.
Dr. Naz, thank you so much for your time this evening here on SABC News. That is Dr. Naz Daniels, a member of the South African Society of Psychiatrists, just giving us a glimpse there into mental health challenges being faced by young pregnant mothers. Of course, this is in line with Pregnancy Awareness Week, starts from today until the 10th of February.